Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Posaconazole. Its brand name is Posanol. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Posaconazole. We'll then touch on an example of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So Posaconazole is a triazole antifungal that blocks the synthesis of ergosterol, a key component of the fungi cell membrane, by inhibition of the CYP450 dependent enzyme lanosterol 14-alpha demethylase, resulting in accumulation of methylated sterol precursors and depletion of ergosterol within the fungal cell membrane. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of oropharyngeal candidiasis. As well, it can be used for the same condition when related to an HIV infection. Patients with invasive candidiasis in severely immunocompromised patients may use this medication prophylactically or preventatively. As well, it could be used preventatively again for patients in severely immunocompromised situations for invasive aspergillosis. With respect to contraindications or reasons we would not be able to prescribe Posaconazole, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to Posaconazole or to any other component of the formulation. As well, this medication should not be used with HMG-CoA reductase inhibitors, primarily metabolized by CYP3A4, as in atorvastatin or lovastatin or even simvastatin. Now, for examples of dosing with Posaconazole, so in invasive aspergillosis, if they're using the suspension, a patient may use 200 milligrams orally 3 times daily. Now, for the tablets or intravenous route of administration, we may see 300 milligrams twice daily on day 1, and then just 300 milligrams once daily. For a duration, we may see this medication used in the setting for 6 to 12 weeks, depending on the disease state, the disease improvement, and the level of immunosuppression. As with all medications, there are some side effects or adverse reactions that patients may experience while using Posaconazole, so we'll go over some of these here now. Keep in mind that these ranges are very large because the percentage in which these side effects may occur depends on the reason why you're using it, as the dosing may change. So for hypokalemia or low potassium levels, it may happen between 22 and 30% of the time. 10 to 42% of patients may experience diarrhea, and nausea may happen 9 to 38% of the time. 7 to 29% of patients may experience vomiting, and 8 to 28% may experience a headache. A fever seems to happen 6 to 45% of the time. Now, one serious side effect with this medication would be a prolonged QT interval, which can happen 1 to 2% of the time. All right, everybody, that's all we're going to talk about today with Posaconazole or Posanol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. That's it for today. Take care.